Right, let's now focus on COVID-19 amidst all the looting and the violence of the past week in KwaZulu-Natal and Gauteng. It's sometimes easy to forget that we are in the middle of a pandemic. We've got the latest numbers that have just come through for the past 24-hour period. Nationally, we're looking at 16,435 new infections. In Gauteng, 7,309. The Western Cape, 2,901 new infections, and in KwaZulu-Natal 490 new infections, and tragically there have been 377 COVID-related deaths in the past 24 hours. I'm joined now by Wits vaccinologist Professor Shabir Madhi. Prof, thank you very much for your time this evening. It's been very difficult to try and understand the numbers, particularly in Gauteng, because everything has been so disrupted by the looting and by the chaos. I would imagine that quite a few people have been avoiding going for tests, so the test number might be lower than it should be. And also at the same time, we were told at the end of the last week that we were probably peaking in terms of our third wave. How do you understand what the numbers are saying around whether Gauteng is now actually over the third wave peak or not?
So in Gauteng, based on data from last week before the disruption started, we had very much started on downward trajectory with a current resurgence. So it would be highly surprising if we don't continue on that current downward trajectory. As you correctly point out, the numbers that are being underestimated.
Prof, I'm so sorry. I'm just going to interrupt you because Professor, I just lost you for a moment because the line went wobbly. You were saying, what I did hear is that it was clear that Gauteng was moving in a downward direction, and after that it was just a garbled mess, and that wasn't you, that was the line. So if you could just start from there again. Thank you.
Yeah. So the data from last week already showed that Gauteng had peaked and it started to come on a downward trajectory. And despite the disruptions of testing, we expect Gauteng to continue declining with the number of daily cases. But that, unfortunately, is not the case for many of the other provinces, and particularly for KwaZulu-Natal as well as the Western Cape. Those provinces are still very much on an upward trajectory and probably are about 3 to 4 weeks away before they actually peak. And with the disruptions that have taken place, as well as with the restrictions that have been put into place, that might be more protracted. So I think what we're experiencing is at a national level, we're seeing a decline in the number of cases. Part of it is the amount of testing that's being done. There are stark differences across the provinces, which makes it difficult to pronounce at the national level.
I want to drill down into KwaZulu-Natal because 490 new infections today. Yesterday it was around 370, which seems quite low, although you say you are worried that it's going up. I'm worried that that figure's lower than actually probably is because of all the disruptions, particularly in those big densely populated areas around Durban and Pietermaritzburg. Loads of people who might be COVID positive have probably just not gone for a test. Is my assessment correct?
Absolutely. KwaZulu-Natal is under report cases, number of infections that are taking place, and unfortunately, it seems that it also has impacted on people being able to access hospitals. So even when it comes to hospitalization and possibly even the number of people that have died, those numbers are very likely being underestimated in KwaZulu-Natal.
I'm going to try one last question, although we have a slightly dodgy line. We know that the 35s and up are now able to register, and quite a few of them are already able to get their vaccinations. Do you think, despite the disruptions of the last week due to the looting, that we're finally on the right track with the vaccination program?
Absolutely. I think there's good reason to lower the age band.
Professor Madhi, you know what?
To be vaccinated. The most important issue is to ensure that we got adequate supply of vaccine, because what we can't compromise on is still to prioritize individuals that are at highest risk of developing.
All right, we're going to leave it there because that line is just absolutely failing us, but I totally got the gist. You say it's absolutely the right thing to do, that we're opening up to the 35s plus, but vaccine supply needs to be carefully monitored. Thank you so much for your time this evening. That's Professor Shabir Madhi. Of course, he's a vaccinologist, also director of the Vaccines and Infectious Diseases Analytical Research Unit at Wits University here in Johannesburg.